Kia ora koutou katoa, ko Ashley Bloomfield toku ingoa. Thanks very much for the opportunity to speak to all of you who are at the Privacy Forum this week. And I'm apologising for not being able to be there in person, but you've got one of our very senior people, Shane Hunter, there as part of the panel following this address. So I look forward to hearing back from Shane, and I know he will contribute enormously to the discussion. I want to just reflect to you some of the lessons on what I call life and leadership from COVID-19 over the last year and a bit that I've been teasing out and talking about with a range of audiences, and I will give that a bit of a flavour around privacy and some of the bits of work we've been doing that you've contributed to, or certainly the Office of the Privacy Commissioner, but also where we've had to be very agile and adapt and change the way we've done things in very rapid time. So perhaps just to reflect on a few of those and some of the lessons from that as well. So clearly, when a pandemic comes along, suddenly everything changes. And one of the things that changed in particular was that things that we had been doing on relatively slow or perhaps in a measured way, we had to rapidly increase delivery on, and we also had to develop new tools, new ways of doing things that we previously hadn't even envisaged. Some of the examples that come to mind are the development of the NZ COVID Tracer app, the establishment and ongoing development of our contact tracing solution, our national contact tracing solution. More recently, of course, the development of our COVID immunisation register. Those are just three examples, but ones that at the beginning of 2020 were not even really on our radar. In fact, they weren't on our radar. So we had to do a lot of very rapid work. And of course, as part of that work, we had to engage with the Office of the Privacy Commissioner and move very quickly through a careful and complete consideration of all those privacy issues. So it was wonderful to be able to leverage the relationships that our team here, our data and digital team and our security team here had established with the Privacy Commissioner to make sure we were covering off those issues and that we were able to address any concerns in a very quick time. If I reflect back on 2020, again going back to the start of the pandemic, and one of the things about a pandemic is that very little is in your control. Things are happening so rapidly. There's an emerging situation. Most of that is happening overseas, and there's a real lack of information about just what's going on. So it's the classic leadership challenge of having to advise on, or indeed make big decisions in a short space of time, but with very incomplete information. And so one of the things I think that serves us very well in that sort of situation in New Zealand, and we've seen this before in the response to other more local emergencies like the Christchurch earthquakes, the Whakaari White Island eruption, more recently the Kaikoura earthquake as well, that the public service in New Zealand, the wider public service, because of the way we work in a very open and transparent way, and because of the relationships that tend to underpin our work, we're able to draw on that very rapidly to be agile, to be very responsive. I think we saw this again in COVID, in the COVID response. And for me, in the role I was in and remain in, particularly in those early days, that ability to reach out and seek support from or information from a whole range of colleagues across the public service, across the health system, and indeed out into communities was fundamental to us being able to mount a really rapid and, as we've seen, actually very successful response. Successful in the sense of actually protecting the health and well-being of New Zealanders first and foremost, as well as it's transpired, protecting our economy from some of the shocks that might have happened if we hadn't followed the route we have. So one of the things that became really apparent to me early on in the response to the pandemic was, because things were moving at such rapid speed, I couldn't possibly be, as the leader in this organisation, I couldn't possibly be across the full range of activities and actions that needed to happen, let alone across the wider health system. So I became, as I am every day, I guess, very reliant on people having a good understanding of what our collective sense of purpose is, and then acting on that. So within their own area of work, seeing what needed to be done and just getting on and doing it. And I think there's no area where this was more obvious to me than in the area of the developments in our digital systems. And I've talked about a couple of examples, the NZ COVID Tracer app, and I'm particularly proud of the work around our contact tracing solution here, where a couple of teams in the ministry sat down, saw what needed to be done. No one asked them to do it, actually. They saw what needed to be done. They recognised we had a huge gap in New Zealand where our contact tracing systems were local. They were very rudimentary in most public health units, often paper-based or just spreadsheet-based in most public health units. So they saw a huge gap there and the need for a national approach to this and a national solution to this. And they stood up, really in the space of about a week, a potential information system that could underpin contact tracing nationally. And they've developed it from there. I think we're now on probably our 23rd or 24th iteration of that approach. And of course, a key part of developing that system was also recognising what the privacy issues might be. And in particular, where you've got quite sensitive clinical information about people, of course, what we're used to dealing with in the health system. And one of the features of that national contact tracing system is that it allows us to share work across the ministry and across all our public health units. So if, for example, there's an outbreak in Auckland, where we've seen virtually all of our recent outbreaks, they're able to share the work with other public health units across the country, and likewise our team in the ministry can do that work. But some really important privacy issues that need to be considered and worked through to ensure that people's information is being treated with respect, and of course where it's only shared really where it needs to be shared. So I'm very proud of the work that our teams have done to develop up those solutions really that have absolutely underpinned our successful response. Same thing happening again over recent months with our COVID immunisation register, where we've had to absolutely expedite that work, something which of course we knew we would need to update our national immunisation register, but it was on a much slower, more measured time frame. That work's needed to happen apace. And again, I want to thank those of you in the Office of the Privacy Commissioner for the support you've provided and for your turnaround of our requests and your willingness to, time after time, work with us on assessing and addressing any privacy concerns. So what are the other big, a couple of other lessons for me from 2020, and these are more general things, and I just hope that perhaps they provide something of value and of interest for you as you think about your work, and also maybe something that can lead into the panel discussion as well. That when you're in that sort of situation where the context is very difficult to control, we talk in leadership terms about the three leadership responsibilities: leading self, leading others, and leading context. And of course, when there's a 1 in 100 year global pandemic, not surprisingly, it's pretty hard to lead the context. So often it will come back to really how do we lead ourselves through that. And one of the things I've been reflecting on from the last year is the importance, when everything in your context is beyond your control, to make sure you don't give away the things that you can control. And of course we can always control our behaviours. We can always control how we think about situations and issues and how we respond to those. And our behaviours are of course anchored in our values. And so the values that I've been thinking about as so important to my personal contribution and response over the last year and a bit through the COVID-19 pandemic, those key values I've been thinking about have been kindness, compassion, which is of course such an important part of our work in the healthcare system, the value of curiosity, of being prepared to always think about, well, what else is going on here? What other information do we need? And also the value of humility. And perhaps just to touch on that latter one, this has really come home to me, is the importance of, as a leader, leading with humility to me is about being prepared to listen, being prepared to ask others for advice, being prepared to say when we don't know, and of course to say when we've got it wrong. and what we're going to do to fix it. And I've had to face situations often on live television at 1 o'clock, pretty much every day for a period there, where I've had a range of reporters with a number of examples of where they need to point out to me where either things didn't go right or indeed where there are gaps in our information. The interesting thing, of course, here is that, and I've had this feedback from members of the public, many of whom still on a daily basis come up to me to thank me and to thank the Ministry of Health and the Public Service for the work we've done to keep them safe. But the interesting point that people make is that why they trusted our response, and in particular when the Prime Minister asked New Zealanders to do something quite extraordinary that hadn't been an experience in anyone's lifetime, which was basically to go home and stay at home to look after each other, to protect each other. And people understood why she was wanting them to do that, because we had communicated openly and transparently. And we had been prepared to say we don't know. We had been prepared to say, actually, that didn't go right, or yes, we got that wrong, or we've changed our minds because actually we've got new information or new evidence. And it was our being prepared to lead with humility, to not have all the answers, to not pretend we had all the answers, that actually built people's trust. And of course, trust in government and trust in our healthcare system is so fundamental, and our people's confidence that we're going to keep their information private is a really important part of that trust as well. Again, I've talked with clinicians about the importance of this lesson about being prepared to say, actually, we don't have all the answers, we don't know, because in our interactions with patients and with family and whānau in that clinical situation, it's really important that we build their trust. The other thing that was really apparent to me, and I've just touched on this, is when the Prime Minister asked New Zealanders to, as I say, go home, stay home, and that was the 21st of March, there were very few people who said, well, why? Why are you asking us to do that? And I've talked about the sort of 6 to 7 weeks we had to inform people about what was going on, to update them regularly, to be open and transparent about what was going on and building that trust. So that again, when the Prime Minister said, I need you to go home, we need to stay home, save lives, be kind, and it was quite a powerful call to action in my mind. But again, people didn't say why, because they knew why. We had been open and transparent. We had brought them in. They understood what was needed, what needed to be done, what our collective sense of purpose was. And I think there's a great leadership lesson in this. All too often we spend too much of our time talking with people about the what and the how. If they understand the why, they actually know or will work out the what and the how. And we saw communities doing this all around the country. We saw iwi Māori among the first in our communities to recognise what was going on and to take action to protect their kaumātua, to protect their communities from COVID-19, because they understood from what had happened 100 years ago, and it was fresh in their minds. They understood what might happen if they didn't take action. So I think there's a real leadership lesson for us as individuals, and for those of you in leadership roles in particular, that actually if people understand why, they will work out, or they know the what and how, and we can spend a bit less time on that. And going back to the example I spoke to earlier about our national contact tracing solution, actually it's a fantastic example of the teams here in the ministry just understanding the why and then sitting down and working out the what and the how. No one needed to ask them to do it. They saw what needed to be done and they went on and did it. And my great hope is, of course, as we move through 2021, where this threat, which is not apparent to us in New Zealand on a daily basis, but it's very, very real in many other countries, that this threat continues to, I guess, unite us in our collective action to keep the virus out of New Zealand, but also to think about how we can protect ourselves and protect others, to continue to protect our vulnerable communities by being vaccinated. And of course, we're doing we've got a huge effort underway to deliver that COVID-19 vaccination program to New Zealanders. A key part of that is our communication around it. And we only have to look back last year as to the pointers about how we should communicate consistently, clearly, transparently, and through a range of channels. And be prepared to say, we don't know. Be prepared to say, actually, we've changed our mind because we have got more information. And people will trust us, and they will trust the program, and they will trust that it is the right thing for them to do to be vaccinated. So I think that's about all I want to say. I just want to finish by coming back to one of the values I talked about, which is the value of kindness. And you'll see that crossover with the call to action that the Prime Minister made on the 21st of March last year, and that I think saw us through in fantastic shape through that period of lockdown, that call to action to stay home, save lives, be kind. And of course, most New Zealanders knew that they weren't staying home to save their own lives. They were staying home to save the life of their elderly parent or neighbour, of their disabled friend. They were staying home because they knew that if COVID-19 got into our community, it would have a much greater impact on our Māori and Pacific communities. And so New Zealanders decided to stay home to actually protect not just themselves, but to protect others. And that call to action to be kind was, I think, a really important one. It's a very different message from stay home and look after yourselves. So in the midst of our response last year, we saw the impact of people acting collectively in each other's interests. And we set out at the start of that lockdown period to try and suppress the growth, to try and bend the curve, to get the numbers of COVID-19 cases down to a level we felt we could manage. And it became apparent after 10 or 14 days that actually New Zealanders had embraced that opportunity, that invitation to collective action so willingly and so fulsomely that actually we were in a position to be able to get rid of the virus in our community, to prevent, to cut off chains of transmission and to eliminate it. And from that was born our elimination strategy. And that's the approach we've taken since, where we do get an incursion or might get an incursion through the border, that actually we won't tolerate the virus in our community and we'll set out to take deliberate steps to eliminate it once again. And so I would like to commend that value of kindness to you, and also just to remind you in your work, and I know you'll have all been working hard over this last year in a time of uncertainty, a time when both professionally and in our personal lives there have been things we've had to navigate that we never thought we might have to. Just encourage you, of course, also to be kind to yourselves. It's hard to be kind to others if you're not being kind to yourselves. And so look after your own well-being too, and make sure you recognise that resilience is not about keeping going. It's about knowing what our boundaries are, what our physical and mental boundaries are, and then taking active steps to stay within those boundaries. So final word, just to wrap up again, to thank you once again for the work you've done to support our work and the broader work that has been New Zealand's successful response to COVID-19, to what is a 1 in 100 year pandemic, the biggest global health threat in 100 years. And that our work, of course, is not finished. And also, as was announced by the government a couple of weeks ago, we're moving into a period too where our healthcare system will be undergoing change, where some of those key enablers of our future healthcare system will be an expanded role for data and digital, and that will require input, more input as well around privacy and around making sure that we are protecting individuals' information so that we can maintain and continue to build New Zealanders' trust and confidence in our healthcare system. So thank you again. I'll look forward to hearing from Shane how the subsequent panel discussion goes, and wish you all the best for the rest of the day. Kia ora.